Can this weight loss medication cause kidney damage or problems? Zepbound is not directly toxic to the kidneys, but its gastrointestinal side effects may cause dehydration that can indirectly affect kidney function. Before we dive in, a quick note: this video is for educational purposes only and is not medical advice. Always speak with your healthcare professional about your specific situation, and never start, stop, or change any medication without your prescriber's guidance. So, Zepbound isn't directly toxic to your kidneys, but there are some important things you need to know about how it can affect kidney function. Let's talk about why this matters. If you're taking Zepbound or considering it, understanding how it interacts with your kidneys helps you use it safely and know what warning signs to watch for. First, let's clear up what Zepbound actually does in your body. It's a dual GIP and GLP-1 receptor agonist. That means it activates specific receptors in your brain, pancreas, and digestive system. This slows down how fast your stomach empties, increases feelings of fullness, and reduces your appetite. The medication is broken down by enzymes in your body and doesn't rely heavily on your kidneys to eliminate it. So, unlike some medications that directly damage kidney tissue, Zepbound isn't inherently nephrotoxic. But here's where things get more complicated. The way Zepbound can affect your kidneys is indirect, and it's related to its side effects. The most common side effects are gastrointestinal. Research shows that nausea occurs in about 29 to 33% of patients. Vomiting happens in 9 to 13%, and diarrhea affects 19 to 21%. When these side effects are severe or persistent, they can lead to dehydration and what doctors call volume depletion. That's when your body doesn't have enough fluid, and when you're dehydrated, your kidneys can't function properly. They need adequate blood flow to filter waste, and dehydration reduces that blood flow. Now, some people are at higher risk than others. If you already have chronic kidney disease, your kidneys are more vulnerable to stress from dehydration. Older adults also face increased risk because kidney function naturally declines with age. And if you're taking certain medications like diuretics, ACE inhibitors, ARBs, or NSAIDs, which are commonly prescribed for blood pressure, heart conditions, or pain, your risk of acute kidney injury goes up. These medications affect how your kidneys handle fluid and electrolytes, so adding dehydration from Zepbound's side effects can create a perfect storm. Heart failure, especially when treated with diuretics, is another condition that can increase your risk. The FDA specifically recommends that doctors monitor kidney function in patients with existing kidney problems who experience severe gastrointestinal reactions while taking Zepbound. This isn't because the medication itself damages the kidneys, but because the combination of pre-existing kidney issues and dehydration can lead to acute kidney injury. So what should you watch for? There are some signs that might indicate your kidneys are being affected. Changes in urination patterns are important. This could mean urinating less frequently, producing darker urine, or noticing swelling in your legs, ankles, or feet. Unusual fatigue or weakness that seems more than just typical tiredness can also be a warning sign. Persistent nausea or vomiting that doesn't improve is definitely something to report to your doctor. And confusion or difficulty concentrating can sometimes indicate that waste products are building up in your blood because your kidneys aren't filtering properly. If you can't keep fluids down for 24 hours, have very little or no urine, feel faint, or develop confusion, seek urgent medical care right away. Don't wait to see if it gets better on its own. Let's talk about what you can do to protect your kidneys while using Zepbound. The single most important thing is staying hydrated. When you're experiencing nausea or other gastrointestinal side effects, you might not feel like drinking, but maintaining adequate fluid intake is essential. Sip water throughout the day, even if you can only take small amounts at a time. If you're on fluid restrictions for conditions like heart failure, follow your clinician's specific guidance on fluids. Have an honest conversation with your doctor about your complete medical history before starting Zepbound. Make sure they know if you have any kidney problems, even mild ones. Tell them about all medications you're taking, including over-the-counter drugs and supplements. If you're on diuretics, blood pressure medications, NSAIDs, or anything else that affects kidney function, your doctor needs to know. Your healthcare provider may check your kidney function with blood tests before you start Zepbound, and periodically while you're taking it, especially if you have risk factors or develop significant gastrointestinal symptoms. This typically involves measuring something called creatinine, which helps assess how well your kidneys are filtering. If you develop severe or persistent vomiting or diarrhea, don't just push through it. contact your doctor. They might need to adjust your treatment or provide additional support to prevent dehydration. Remember, do not change your dose or stop the medication without your prescriber's guidance. So let's recap the key points. Zepbound isn't directly toxic to your kidneys, but its gastrointestinal side effects can cause dehydration that may indirectly impact kidney function. People with existing kidney disease, older adults, those with heart failure, and those taking certain medications like diuretics, blood pressure medications, or NSAIDs face higher risk. Staying well hydrated and reporting persistent symptoms to your doctor are your best protective strategies. What's your experience been with managing side effects on weight management medications? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.